Director for the Digital Data and Technology Program at an organization called NHSX, which I will go on to explain about very, very briefly. Now, this slide really speaks about the importance of the NHS, but not just that, but the role that digital can play within it, and hopefully you as well one day. So the only way that the NHS can meet their challenges of the rising demand, costs, and expectations is to use digital transformation to transform itself. So there's a huge potential to improve productivity, safety experience, and outcomes for patients, people in care, and the workforce, which I'm going to speak about now and how to join the NHS. So the diversity of roles within the NHS. So how many different NHS careers and roles do you think there could possibly be? Is it just medical roles? Would you say 50 or 100? Well, actually, there are 350 different roles that you can do. And of these, there are about 150 supporting admin business-related roles that provide key supports to clinicians, doctors, nurses, and other types of support workers. Now, these types of roles are usually grouped into a variety of different areas, and just some of them: project and program management, user-centered design, data analytics, communications and media, training, information and communication technology. Now, user-centered design, as it mentions there, is all about how can the NHS and also care organisations like social care actually have services which people will use and can access easily. Data analytics is looking at how data can play a big role in helping people to live longer and healthier lives. And we need skills all the time. We need people that are willing to learn these different skills to fill these really key roles in supporting clinicians. Now, as you can see just on the right hand of the slide there's a number of different routes, a number of different questions that you may have that are all answered on the Health Careers website, and the link is on the slide. So please do go to that website, because there's a lot of information that will tell you much more about all of these different roles, and possibly one that will pique your interest. So, as I said, going to that Health Careers website, which is on the slide here, is really important. There's so much information on that website that will be obviously of interest to you, and you can find out a lot more before you think about what you would like to do. Now, there isn't just one route in. A lot of people think that you have to have a degree to be able to go and work within roles within NHS, and that's not the truth. There are different graduate schemes that are really good, that is true, but there are also lots and lots of apprenticeships based on even where you live. In East London, all of the NHS organisations or hospitals there, they'll have their own apprenticeship schemes, and then departments with their own apprenticeship schemes. And then national organisations like NHSX that I work for also do have apprenticeship schemes. And then there's also the normal application process on the jobs.nhs.uk website. Now, entries in, if you don't want to do the graduate scheme, or you're not going to go to uni, or maybe the apprenticeship, one that you like is not on there, you may actually see a role that you want to do on the actual main jobs.nhs.uk website. Now, obviously, starting off being young and eager and willing to learn, there are lots of entry-level jobs such as administrator roles, admin assistant roles, in different departments, like I mentioned just briefly. So in IT, in communications, in media, in training, in business support for project management, in business support for program management, lots and lots of different opportunities, and there's lots of help within the website to be able to assist you in going through those applications. Now, within the NHS, there are lots of different areas and ability to progress and do different things. I started off in the outpatient department. That's a department which people come to have appointments with consultants, and I was responsible for managing the transport service. So that transport service looked after patients, picked them up and dropped them home after their outpatient appointments. But obviously I didn't stay there, and I was able to hop around into different roles, as it were, and I'll go into speak about that briefly in a couple of slides. Now, the NHS is not just hospitals, not just big hospitals like Newham General or BHRT, which is also in East London, but there's also NHS organisations which are office-based, and as I said, perform a lot of the functions which help the frontline clinicians to do their job. Now, again, if you're interested in those office roles, things I've been mentioning, digital health, then just go to Health Careers website, which I've been able to stick on a number of these slides. So with NHSX, we are looking to do three things. So digitize, connect, and transform. So supporting all NHS and social care services so that they can really be able to have the great infrastructure to work easier together, connecting services together so that information and data which patients and citizens want to be shared can be used with these professionals so that they can offer great care as well. And then we want to transform things so that citizens, people, ones like you, can get access to your own data information, which we know is really important to people, isn't it? So for myself, how did I get into the NHS or to digital? Well, as I said, started off working as an admin assistant at Whips Cross Hospital. Then I progressed to being a business support manager. So what that really involved was looking at diaries and different things, which obviously are really helpful for people to know, key meetings, key things and events to try and progress and design work. And then I became a project manager, then program manager. So I looked after projects like setting up a diabetes service, setting up a easy breathing service, setting up a service and a clinic in the GP practices which help people to have their blood taken there and to obviously manage other conditions. So I worked on a lot of different projects over a few years. Then I became a head of digital in Northwest London, actually. So for all of the NHS organisations there, I was performing that function. And then I became assistant director of program management. So that was looking after about 100 different programs. And it was just making sure that different people that were leading those programs were trying to get the best benefit for patients and that these were designed really properly as well. And now I am the assistant director of digital and data. As I was saying in the previous session, it really is very broad in terms of what digital involves. It could involve things like how do we work with Microsoft to use things like the Microsoft Office applications to enable social workers, to enable doctors and nurses to be able to work efficiently together and use video conferencing like MS Teams to be able to help people. And then it also involves working with companies like Google, Apple, Microsoft, as I said, and even Amazon, and we get to work with as well. So there's a lots of things that I get to work with, which is a real privilege too. But ultimately, all of it is about improving health and care for citizens, for people across the whole of England. So that's just a little bit about me. If you have any sort of questions or you want to know more, as I said, please go to the healthcareers.nhs.uk website, and that will give you a lot more information. And that's it from me. Oh, there's a few comments. So,
hi, Kwesi. It's Meg.
Hi, sorry.
It's really interesting to hear about your your journey into your role right now. Okay, just one question from me. Would you be able to kind of talk more about like the NHS digital? Is that what the MSc one?
Oh, yes, so sorry, I didn't even cover the courses that I will. That's fine. Sorry about that. So the courses, the sort of key courses I did, because I didn't go to university. I come from a single parent family, and after leaving college, it really was, a pressing need for me to go into the workplace. But my mum, who was a nurse at the time, is the reason why I ultimately chose the NHS. So something which would help with obviously our household sort of payments we needed to make, but also be able to be in an organisation where I wanted to help people. And what's interesting is along the way I've had lots of opportunities to do lots of courses. These are just some of the main ones, I suppose, that helped me be able to progress on the ladder and get more senior roles as well, and obviously go up in my banding as well. So the course is there, as you can see, on the right. It's a Prince 2. Strange name, isn't it? Now, I'm hopefully I'm not going to mess up on the explanation of this acronym. Um, but this is projects in, oh no, yeah, projects in controlled environments. Goodness, if I didn't get that, that would have been painful. The projects in controlled environments, and that is essentially a way of managing projects. There are lots of different methodologies in terms of managing projects, and Prince 2 is one of them. So I did that course. It took about 5 days of intensive learning, and there's an exam at the end. And the vast majority of NHS organisations, if not all, will provide opportunities to do training as you're working. And I was fortunate enough to be able to have this paid for me by the organisation because it contributed to my development. So that's something very important. Then Agile is another project methodology, another way of managing projects, depending on the type of project that you've got. So in my role now, and probably for the last 3 or 4 years, I've been using Agile project methodology. So do Google it if you want to know a little bit more about it. And the Digital Pioneer Fellowship was a course over about a year. So I could still work as I did this course. And it was about 6 or 7 days of residential learning or learning within a classroom with other people that were interested in digital. And that was giving us the right tools, the right sort of tips, and I suppose ways in which we could be confident digital leaders in our roles and be able to help us to progress and be better leaders. And I learned so much from that course, from working with other people, learning the barriers and things that they were dealing with. It was really good because you could also sort of see that you weren't alone and that other people are dealing with tough things they need to work through in order to be a good digital leader and the different roadblocks. And it was a really great shared learning process. And because I went on that course, I was then eligible to doing the NHS or joining the NHS Digital Academy, where I'm working towards an MSc. So what's very interesting is that even though I didn't get to go to uni when I was younger, I'm able to do now a work-based degree and get a certificate which is part of that course. So that's over the next year that I'll be doing. I only started last month. A lot of reading, a lot of work already. So getting myself into gear is proving challenging. But what's really good is that, again, similar to the Digital Pioneer Fellowship, I'm able to do it as I work, hand in coursework, and then hopefully be able to pass at the end of the year as well. So that's just a little bit about the different courses that I've done, been able to be engaged with, and it's been completely supported within the different departments that I've worked within the different NHS organisations that I've been a part of. As I said at the bottom there, we would advise anyone to try and do a course, maybe a short course in business administration, digital and IT. If you're not going down the uni route, there's lots of different sort of low-cost ones, and probably even free because you're students that you could get access to doing some online learning. I really would advise that before probably applying for the NHS for the sort of business or admin roles. it really shows the employer, you know, this person's used their initiative. They've tried to do what they can in terms of getting, you know, obviously information and knowledge on the particular subject. So again, please go to healthcareers.nhs.uk, and there's a lot of information, even access to courses and tips on how you can join the NHS as well. So the types of projects as well that you could be involved in, so varied. They could be medical related, so you could be setting up diabetes service that may be running a GP in an area. You could be designing a project which could be part of the estates department or a program. They could be looking at actually building something. You could be working on an IT related one. It could be one related to potentially the rollout of Windows 11 across a hospital or across an NHS organisation. You could be managing a project where we're working with patients, social care, and other NHS people to look at maybe a patient pathway and how that can be simplified and how that can actually be done in a way where patients think that, yes, this is helpful, I would like to use that. There's so many different types of projects I've had the privilege of being involved in, and that have not even been able to touch as well. So there's so many, depending on what you like, I'm sure there'd be a project, team, or program that you would be able to join.
Great. Thanks so much, Kwesi. I think that concludes our presentation for today.